Mr. Richard Holden.
Thank you, Mr. Deputy Speaker. When I put forth this adjournment debate, the situation was in no means as clear as it appears to be following the announcement from the Prime Minister and Health Secretary last week. Shotley Bridge has been at the heart of the community in North West Durham for decades. Initially in 1912, when it was founded as a sanatorium for TB. Then, following the First World War, it was leased to the Ministry of Health to house and rehabilitate military casualties. It was transferred back to local authority control for use as a facility for mental illness before again becoming involved in the war effort in 1941. When it became an emergency hospital back in 1941, and the 16 now demolished huts that adorn the site were built. Following the Beveridge report of the 1940s, the National Health Service white paper in 1994 by Sir Henry Wilnick, and finally the formal beginnings of our National Health Service under Honorin Bevan, Shotley Bridge joined our NHS in 1948. And it's in that Liberal, Conservative, Labour cross-party consensus that the new plans for Shotley Bridge Hospital have been founded as well, or the replacement for Shotley Bridge Hospital. And I'd particularly like to pay tribute to some of the local councillors who I've been meeting with on the Shotley Bridge Reference Group, particularly councillors Alex Watson, Owen Temple, Alan Shield, and many others, and also these excellent staff at the CCG and the local hospital trust who've met with me on many occasions over the last few months. Partly as a result of the steelworks at Concert and also from its wartime use, Shotley Bridge became a hospital that was known for its plastics and burns treatments. A new outpatient block joined in 1950, and the tower, still there today, built in 1969, was the last massive major investment in the site. The opening of the new University Hospital of North Durham, University Hospital of North Durham, known locally and by everyone in the area, including, I'm sure, my friend, the member for North Durham as Dryburn, was opened in 2001, and with it moved many of the services from Shotley Bridge to other parts of the county. And in 2005, the majority of the old hospital buildings on the site were demolished and have now become a part of the growing Concert housing estate. Shotley Bridge Community Hospital now, though, still forms very much a part of the community and is a real source of local pride. I'm reliably informed that you can tell if a nurse was trained at Shotley Bridge by the way they are and their professionalism. And it's also obviously had Sir Simon Stevens, the current Chief Executive of the NHS himself, did his early training at Shotley Bridge Hospital. Although perhaps one of the reasons that Shotley is such a part of the community is the fact that anybody who lived and grew up in Concert and was able to vote for it at the last general election was likely to have been born there. Although since 2001, obviously, the maternity services have moved. Now a community hospital with an 8-bed ward, an urgent care centre, a number of outpatient treatments, Shotley Bridge is still very much at the heart of our local area. During the recent coronavirus outbreak, it particularly showed its worth as places like Shotley Bridge were really able to step up and provide some of the facilities that were needed. However, even at the height of the COVID-19 outbreak, over half the floor space at the hospital was still unused, a fact I got from the Chief Executive of the local hospital just recently, although it was briefly stepped up to 24 beds. With almost all the buildings now at least 50 years old, many much older than that, costs of running repairs amount to over £1.5 million a year. And services have slowly moved away. Local people have been campaigning hard to stop the hospital closing completely, and I pay a huge tribute to the efforts of many local people over many years. Securing the future of local hospital provision was at the core of my local election campaign in North West Durham. And since being elected, it's something I've been pressing ministers on remorselessly in this House. In my maiden speech, at Prime Minister's questions, in questions and debates with ministers from the Minister's department, and indeed with the Minister himself. In fact, even before today, Shotley Bridge Hospital had been mentioned by me 7 times in the last 10 months, which is a significant uptick on the previous 10 years, in which it had been mentioned just twice. I was delighted to have the Secretary of State join me on a visit to Shotley Bridge last month, the first time that any member of staff there could remember a health minister visiting the facility. I had actually initially invited my honourable friend the Minister to come, but the Secretary of State clearly decided to steal it for himself, which is fair enough. And the Secretary of State was really impressed by what he saw as well, particularly some of the nurse-led units, the fact that there's a huge integration with local GP practices near the site, and also the fact that chemo services from across Durham had been moved to the hospital during the coronavirus outbreak. Actually a really sensible innovation to keep very vulnerable patients away from acute centres, and something I hope that has happened at Shotley Bridge but will be replicated in other places across other community hospitals across the country. With Shotley Bridge now joining the list of 40 hospitals that the government is committed to, I'd like to offer my personal thanks, as well as that of many of my constituents, for the support the government is providing. The overall programme of over £3 billion is one of the largest capital investments for many years, and this capital investment is on top of the extra £33.9 billion a year that we're going to be seeing into our NHS by 2023-2024, which is helping to provide some of those excellent extra doctors and nurses we can now see are starting to come through onto the front line. Obviously, the announcement is hugely welcome from the Prime Minister and Health Secretary, but I'm not the sort of MP who's just going to go away and shut up, to borrow a phrase from a former government minister I once worked for, although I must add, not when I was his special advisor. So I'd like to push the Minister today on a few points on the announcement. Last year it was made clear that some of the monies for the hospital had been secured. However, this was well short of what would be required for a new facility, as outlined by the Secretary of State in his letter to me at the 2nd of October. So if the Minister could confirm publicly the details of the Secretary of State's letter to me, with a new 16-bed hospital, unscheduled care services, and outpatient services, including chemotherapy and x-rays, I'd really appreciate it. I give way to my honourable friend.
For the honourable give way and congratulate him on securing this debate. And he's right in terms of the community support, not only in his constituency, but it also serves North Durham as well. But I wonder whether you could just clarify, it's obviously welcome news if the money's in place, but there seems to be a bit of confusion locally about the siting of where it's actually finally going to be, and also whether there are going to be 16 beds or not. I wonder if he's going to update on those actual details.
Thank my honourable friend for mentioning that. So my understanding is that there are still 3 sites under discussion, but it's going to be around concert. And on the second point, I'm just pushing exactly the Minister on that point of 16 beds, because that's what was in the Secretary of State's letter to me, and I want to make sure that that's the case. If you'd like to go ahead again.
So, I mean, I think because community beds are needed, certainly for respite and other things in the area, and he's right about the trust in terms of the cancer treatment that's done there. But the CCG wrote to me this week saying there's not yet clarification about the 16 beds or not. I don't know whether
I think we're talking at the same point to push the Minister on this exact point. As I'm going back to my rest of my speech, unscheduled care and obviously outpatient services, including chemotherapy and x-rays. And crucially, that the government funding from the hospital programme will cover the difference between money sourced so far from local funds, the 17 million, which my honourable friend will know was confirmed last year, and whatever will be needed for this for the facility. It's really great to see that some capital investment is really coming to deliver on the levelling up agenda on which I was elected. It isn't all about capital, it is also about investment in skills, so it was great to see some of that other investment announced last week for skills and training. But part of it is because communities like mine do feel very much that over decades that they haven't been given a fair crack of the whip and have been left behind. I'd also like the Minister to confirm that this won't be under any form of PFI deal. That is another thing that constituents of mine have mentioned, is that they're concerned that over the last few years, especially under the last Labour government, what we saw was hospitals level with essentially very large debt, and that really caused them problems in the longer term, something which has afflicted hospitals and facilities across County Durham. And finally, just to highlight the great work that was done at Shotley and by all the great NHS staff across County Durham and Darlington, some of whom were seriously ill and a couple of whom died from COVID. There are a lot of local questions around COVID at the moment. Could the Minister just perhaps talk a little bit around the work that he's doing to ensure that none of the measures that obviously have been asked for by local authorities in our area, but none of them, either at a local or a national level, will be in place any longer than they need to be, because we want to see our communities back running as quickly as possible and providing those healthcare services that people want across the board. Thank you very much.
Minister. Thank you very much, Mr. Deputy Speaker. I congratulate my honourable friend for securing this evening's debate on this important issue. His timeliness in doing so is, as ever, perfect, as was his impressive history lesson, but also his relating that history of the hospital to the present. The issue he's raised in the House today, the future of Shotley Bridge Hospital, is, as he says, one that this House is familiar with in recent months, through his regularly raising it in this chamber on behalf of his constituents and his local campaigning on it. Something well attested to on his website and indeed well reported, certainly in recent weeks, if I recall, in both the Chronicle and Concert magazine. Indeed, as he said, he's also very kindly invited me to visit Shotley Bridge in his North West Durham constituency to see the hospital for myself. However, I cannot blame him for upgrading last month in securing a visit instead from my right honourable friend, the Secretary of State, that I hope perhaps that I might yet enjoy North West Durham and County Durham hospitality and a welcome if my invitation to visit as well still stands.
The invitation definitely still stands, and he's welcome whenever he'd like to visit.
To my honourable friend, having secured that re-invitation, I would like to put on record, as he did in his speech, my thanks to all who work in Shotley Bridge Hospital and more broadly in County Durham and Darlington NHS Foundation Trust for the amazing work they have done for his constituents and more broadly during the pandemic, but indeed for the care that they all provide day in, day out, all year round, regardless of the public health context. Shotley Bridge Hospital, as he alluded to, is a key part of the local healthcare landscape in the services it provides. But as my honourable friend has so effectively made the case, there is even more that it has the potential to do. Now, I know that the STP set out the long-term approach to the strategic delivery of health services in his areas, but that the CCG and the Trust itself have undertaken considerable work on this as well. The current hospital, while, as I say, its staff do an amazing job, faces challenges. In the last financial year, and I'm sure my honourable friend will correct me if I get this wrong, it had total running costs of around £1.7 million and £570,000 annual maintenance costs simply to keep the buildings working. And not only are these annual costs a challenge, so too, as he set out, is the nature of the physical space and its usage at the current site, as indeed access to it. The case for and commitment to the hospital is clear, and there has already been, as I understand it, a consultation on elements of this in spring of 2019. Therefore, I was extremely pleased that my honourable friend's campaigning has paid off, and that a new hospital for Shotley Bridge was included in the list of the £3.7 billion investment in 40 new hospitals to be built that my right honourable friend, the Prime Minister, announced late last week. It is a reflection, Mr. Deputy Speaker, of a government delivering on its pledges to build 40 new hospitals, and it is a fantastic example of this government delivering on its commitment to levelling up. This new hospital for the people of North West Durham, and indeed more broadly, reflects the healthcare needs of that local population and the local context. The CCG and Trust, as I understand it, continue to work up the details and consult further, and I encourage my honourable friend, as indeed I believe he is, to continue working closely with them in that endeavour. But let there be no doubt about what he has achieved with this announcement. Less than a year after being elected, after, as he said, a decade of this barely being spoken about and barely being raised in this House, and I put an honourable exemption to that, in that the honourable gentleman, the member for North Durham, I know, has continued to raise this and works indeed with my honourable friend, but in a second. But I know that as the member for North West Durham, it is his passion that has delivered this result. Of course I give way.
So I congratulate the honourable gentleman for his efforts, but there's been a lot of work done on this over many years, including, I know he mentioned councillors, it excluded the Labour councillors and Durham County Council have been working with the CCG and others to deliver this, and it is something which will benefit the entire area. And I think the important thing is that, yes, I congratulate him, but there's a lot of work done before the honourable member for North West Durham even knew where Concert was.
Well, I suspect my honourable friend has long known where Concert is and has been campaigning hard since his election. But I take the right honourable gentleman's intervention in the spirit in which it's meant, I think. And I did, as I say, I alluded to his work on this, it is only right that I do. But he's also right in my references earlier to the work that had been done previously in terms of the consultation to the CCG and others. He is right. It is important that I also recognise the work done by councillors and other local campaigners and indeed local people in that context. The new hospital for the people of North West Durham and the broader region, as the right honourable gentleman rightly alludes to, will be part of a model of care developed to reflect the healthcare needs of that local population, as I have said. My honourable friend has, in working to understand those healthcare needs and working with others, as is his way, secured agreement to the delivery and funding of one of his key local election pledges when he stood for this House in 2019. And to answer some of his questions specifically, we will fund this new hospital, and I have no intention of that being through a PFI. Now, my honourable friend has been clear, and I agree with him, that this new hospital will not only contain, as he has set out, an enhanced range of services, but crucially, those inpatient beds which he has been so very, very clear about. And as the Trust and others work through...
It being 7 o'clock, I must put the question again. The question is that this House do now adjourn. Minister.
Thank you very much, Mr. Deputy Speaker. I should have seen that come. As a former member of the Procedure Committee, I should have remembered that was coming. However, I will pick up where I left off. His commitment is clear, and I agree with him that those inpatient beds are absolutely crucial. I know that initially there was some talk or some suggestion of of no inpatient beds or a smaller number. He has been very clear that it needs to be 16. I heed what he says. I look forward, of course, to receiving the detailed business cases in the coming months, and presuming, as he and other honourable members would expect, they meet the standards we would expect for the spending of public money and robust project delivery, to approving them and securing their approval from the Treasury. And I also look forward, subject to that consent being forthcoming, to seeing construction start 2022 to 23, hopefully with a swift construction, so his constituents, the right honourable gentleman's constituents, can enjoy the facilities of a new hospital as swiftly as possible. He mentioned, I think, one other point, which was about restrictions related to tackling the COVID pandemic and indeed their impact on the health service and the provision of normal health services only being in place as long as they are necessary to protect public health. I entirely agree with him. None of us wish to see them in place a day longer than they are necessary to achieve that primary purpose, but regrettably they do remain necessary at the moment to ensure the safety of patients and others accessing those services. Mr. Deputy Speaker, the title of this debate is, if I recall, The Future of Shotley Bridge Hospital. Well, thanks to the staff at the hospital, it has a bright future. Thanks to the local people, the local campaigners and their passion for this hospital, it has a bright future. But thanks to my honourable friend, it has an incredibly bright future. He has secured that future, that brighter future, through his campaigning and his success in his campaign. His is a plan that, according, if I recall correctly, to a survey of local residents, local constituents that he undertook, I think 92% of those responding agreed with the approach he was proposing. Mr Deputy Speaker, this is a government that delivers on its pledges. And the honourable member for North West Durham is a local MP who delivers on his pledges to his constituents, and they are lucky to have him representing them in this place. He is a strong voice for them, and he has played a central role in delivering that brighter future for Shotley Bridge Hospital, Mr Deputy Speaker.